morning and welcome to The Sleep Show. Alongside Dr. Bethaney Brenner, I'm Gary Byron. You can find her online at theburlingtondentist.com. She is a dentist, so look at that. You get two for the price of one here. If you want to email her, maybe you want to schedule a consultation with her. Maybe you want to zip her over a quick little anecdote from something that you may have heard this morning. Then send it to Dr. Brenner Radio. That's doctor. You don't have to spell out doctor. It's DrBrenner radio at gmail.com. I think something more important, though, is the phone number, because this way you can schedule your consultation with her immediately. 860-673-7155. 860-673-7155. And by the way, if you, for some reason, missed any of those points of contact, no worries. I'm going to repeat them at least a couple of more times before the show is over. Well, good morning. It's great to see you.
Thank you. You too.
Well, I appreciate that. It's our show before Christmas. I like your shirt, by the way.
Thank you. Thank you. You know, it's time to dress up in the fun stuff.
Are you in the festive spirit?
I am trying to be upbeat. It's so funny because I wear this at work too.
As you should.
Well, I wear a clinic jacket over, so I cover up most of it. But at the same time, everybody's going happy holidays, you know.
Yeah.
So, yeah.
You can't be humbug.
Well, some people can be.
Well, yeah, let them be.
Yeah.
I try to spread a little joy and cheer.
So, you know what's interesting is I have a dear friend, and she collects Grinches. Every year she gets a Grinch ornament, and she has a niece that likes the Grinch ornaments, and she's got another niece that likes Grinch ornaments. And I said, I never even heard of a Grinch ornament. But evidently, they put them on their Christmas trees.
You're a mean one.
Yeah, exactly.
Mr. Grinch.
So we have fun with that.
It's our last show before Christmas, right? What's today?
So.
Today's the 20th.
Yeah.
All right. So
are you all ready?
Am I ready? I think later today. What's today?
You're gonna finish all your Christmas shopping?
Yeah. There's just like three or four smaller things. Like the big stuff, I got it for everybody.
Okay.
A couple of little things here, there, you know.
Yeah.
Yeah, maybe a $50 gift card for this, a $40 one for that.
It's the teenagers and the young ones that are kind of tough to get
that's
for.
all done.
Yeah. Well, those are the grades for gift cards. I used to do that for the nieces and nephews because they could use it after Christmas to go shopping, and they got great deals because everything goes on sale after Christmas.
Isn't that wild?
I know. And it's like, why not give them the gift card then? Because then they would come back and show me all the stuff that they bought.
Unless the stores catch on to this and they start going, oh, let's not put anything on sale too quickly here.
They all want to get rid of their inventory because they have to pay for it again in January. That's why they do inventories, so they have to say what they have left because they pay taxes or there's something about the inventory they have to pay for. I'm not in a store, so I don't know. So I don't. And
then you'll start seeing spring stuff start coming out come January as well.
Valentine's Day.
That's the day after Christmas. You walk into a CVS.
We're getting Christmas decorations in September now. It's like, oh my gosh. I know.
That just ruins it for me. And then, you know what? My favorite holiday we've discussed is Thanksgiving. That always gets overlooked. Anyhow.
That's because the food is so good.
Oh, isn't it though? Isn't it? Let's talk about, you know what I wanted to ask you, and we always seem to run out of time every time we get together on Saturdays. The nose. A
very important anatomy.
Yeah, so other than, we know, common sense, we need it to breathe. We can breathe through our mouth, we can breathe through our nose. You always emphasize the nose. Trainers will do that too. If you're running, they'll tell you breathe through your nose, not your mouth. But it also is linked to snoring. Why is the nose so important? Let me ask you that way.
So actually, I brought an article with me. So I'm going to read parts of this just because they say it so well, because this is part of the research, and these are things that I read and bring in here. There's one gentleman says, for as long as I can remember, each breath felt like preparing a swim underwater. A hard suck of air that never quite filled my lungs. Often I'd walk around with a faint whistle in my nose, praying that no one could hear it. The worst problem was minor disability that most people refused to believe was real. Something about the crucial architecture of my face made it physically impossible to blow my nose. The world was a constant sniffle. And this is what I see. I have people that cannot come in and they cannot breathe through their nose. But when you ask them, how well do you breathe? They'll tell me fine. So then I check them because there's a test that I can do. And then they go, oh, I can't breathe. Yeah, it's a very interesting dynamic. So some of them some have very severely deviated septums. So an ENT can do surgery and help people out with that. So I always defer to making sure you check with an ENT, an ears, nose, throat specialist. And that's because they can find polyps, tumors, deviated septums, things of that nature that can be corrected. Okay. Not everybody needs a correction of that magnitude. You can have a minor deviated septum, which doesn't require surgery, and people can kind of breathe okay. And the reason I say okay is because then it falls in my realm where I can do a palatal expansion, and your sinuses sit above your back teeth on the top. And that's where, when we expand you, even as a child, we actually open up your airway. Interesting.
It's the nose that causes snoring, right?
So when you cannot breathe through your nose, and it will get stuffed up, and that's part of this continuing conversation we're going to do today, I'm sure, why does the nose get stuffed up while you're sleeping? Okay, so we'll get to that in a moment. Yeah. So why is this important is because when your nose doesn't breathe well, and we call that a fragmentation in your sleep, because now you're not getting enough oxygen sniffed through the nose, you're going to start to open your mouth and snore. Now, that complicates things, right? So I'm going to read you another things because we talk about the turbinates. So when people have their nose fixed, I'm going to say a deviated septum, they straighten out the septum, and a lot of times because their turbinates are so enlarged, and this is very soft tissue, it's not bone, okay? You think of the septum being the very thin bone that separates one nostril from the other. When you have swelling tissue, and this is going to sound a little crazy, but they call it erectile tissue that's in the nose. So those turbinates are made of that tissue. It's very responsive tissue. So why does it swell up? That's the big question, right? I know that I can look at that on a sleep study. So one of the things that I look for is what they call an RDI score. That's a respiratory distress score. So what does that mean? So if I'm looking at a very high score there, it means
your breathing is interfered?
Exactly. And when it's interfered, what does it lead to, if it's bad enough? A sleep apneic event. Okay? So that's why I go back to breathing through the nose is so important. And if you don't use it, you lose it. So when you start breathing through your mouth all the time, and you can't keep your lips closed, and this is why I tell mothers of newborn babies, keep pushing up the chin to close the mouth, because the children need to use the nose, and they need to get in that habit at a very early age, in infancy, a newborn baby. Okay? So we want to teach them breathe through the nose, because that helps. The breathing actually is activating things. And in that, we activate the nose hairs. And I know that's going to seem weird, right? It says, so together with your nose hairs, your hardworking turbinates sift through the dust, bacteria, and viruses and more, an advantage you won't get through breathing through your mouth. They can be the first line of defense for your immune system. So if we all go back to COVID, and this year we're running into the cold weather, we're going to see colds and flus start to abound, right?
Like every year.
Right, it's every year.
Beginning of time,
guess what? The guys who are the mouth breathers get sick first. Why do you think they get sick first?
Well, it's going directly into your mouth.
Into your lungs.
Because you're breathing. That's where you're breathing. And rather than your nose, it's coming into your mouth.
Exactly. Now, when you breathe in, it goes straight to the tonsils, one of your first lines of defense. So what do you get? A sore throat. You might get a sore, a postnasal drip, okay, because that starts things up. And then you suck it into your lungs, and you wonder why people get pneumonia. You can get that. You can get bronchitis, and you can get upper respiratory flus and colds, okay? So everybody that I put on nasal sprays, and I'm going to say you can use a very good quality saline nasal spray.
They work?
And they work.
Oh.
They only work for 2 hours. Okay, that's the drawback to it, but they do work. So you have to spray your nose a little more constantly. And so I tell people there's a great product. It looks like Xlear, but it It's pronounced Clear. It's a Scandinavian product that actually they brought over and tested with COVID. Everybody who was spraying their nose or flushing their nose with their product did not get COVID. But they weren't allowed to advertise that to the public because the FDA said, no, I'm sorry, you can't say that, even though they had the studies to prove it. So I look at this and so I had a lot of patients that were on these products because I'm treating their sleep and I'm treating their sleep apnea, and I want their nasal passages clear, okay? Because if we can breathe through our nose, we're not going to have as many apneic events, and that's totally true. The other thing that happens when you can't breathe through your nose is you gag. So people have trouble with dental x-rays. All I have to do is spray their nose and they can take the x-rays, no problem. Interesting, right?
Wow.
Guess what else happens to people who can't breathe through their nose? They'll lock their jaw.
Lockjaw.
Well, it's not lockjaw like toxin, okay? That's a particular botulinum toxin that causes lockjaw.
Okay.
But their jaws will lock. Now, some people can unlock their jaws, okay, if they get locked open or locked closed. But some don't. They don't take care of it right away, and then they're permanently stuck in that position. So this is why I tell people who lock their jaws and they call and they don't know quite what to do. They usually go to the physician who doesn't know what to do. Then they go to the emergency room if they're locked open, okay? And they will like give you Valium and they'll try to manipulate your face. But some people, it's like until the Valium really clicks in, they're stuck open and they can't talk. They're just drooling. So it's very upsetting when you get that situation happening. And worse if it happens in a foreign country.
Hope I never have that.
I know. So when they come in and we spray their nose, we can unlock them.
Fascinating.
It isn't it? So the nose is far more important than people give it credit for.
What about people who've got that constant sniffle?
Well, so we have allergies that can also...
Yeah, but I don't mean... That's usually temporary, depending on the time of year it is. But there's some people year-round that have a perpetual sniffle.
Right.
What about that?
That's the same thing. So we just read this guy had a constant sniffle, right? Because the cilia hairs that are in our sinuses, they take all the fluids, the mucus, and they drive it up and out the nose, which is why you get a postnasal drip, or you blow your nose and you can remove it. But when you can't blow your nose because the nose isn't wide enough, okay, so it goes back to the beginning of our conversation, right? You're going to mouth breathe.
You have no choice.
Right.
If you can't breathe through your nose, you have to
Right. So
breathe through your
people who
mouth.
have constant sniffles typically have sleep apnea. So that's another symptom.
It's all linked together.
Exactly. This is why I talk. It's a whole body immune system situation. It has to do with how well you sleep at night, how well you function during the day. What you're eating also affects the nose. So when I look at high respiratory distress index on the sleep studies, I'm going after what are you eating? Tell me give me a food diary. Right? And then they get mad at me because they don't want to eat the way I'm suggesting because we need to reduce the inflammatory response in the gut. Okay, so the gut drives the inflammation that swells up our nose when we go to sleep. So as I said to you, explain why you have a problem breathing 3 to 4 hours after you go to bed. So if you've eaten a big pasta meal, had a few glasses of wine with that.
Oh, yeah, you're going to have some problems.
You're going to have and so we all think it's the alcohol, but not always is it the alcohol, because you can have 1 glass of wine, you're not drunk, right?
You could have 2 glasses of wine and you're not drunk.
Well, some people.
Well, isn't your body? I've had 2 glasses of wine and was
You're
totally
a guy.
fine.
You're not a 4-foot girl.
Oh.
You have to remember we have body size
Right.
that has an impact on that.
Sure.
So some people are more sensitive to the alcohol than others,
gotcha.
okay?
Yeah.
So 1 glass of wine typically, and they say for women, 1 glass of wine. For guys, you can have 2.
I believe that.
Okay?
Yeah.
So this is what I see come through the medical literature, all right? This is what they're recommending. Don't do more than that. You can do 1, don't do 2. So when you go to sleep, 3 to 4 hours into sleep, your nose starts to block up because the tissue in the nose swells up. And then what happens? Now we're going to breathe through our mouth.
Can't breathe. Yeah, you can see it's stuffed
You're
up.
going to start to breathe through your mouth. Now, we talked about dry mouth a little bit, right? So when you're breathing through your mouth, you're going to dry it out. One of the tests that I do is I take a tongue blade, like the doctors stick down your throat. We always hate that. I can stick it on the inside of the cheek. If it sticks, you have dry mouth. Okay? Guess what happens in a dry mouth with sleep apnea? Even if you don't have a high score of sleep apnea, what do you think is going to happen to that person? So when they are laying on their back and they're opening their mouth and the jaw falls back, the tongue falls back. Yeah, exactly. Put your head back and see how that feels, right?
Yeah.
So your tongue falls back, your jaw falls open, and now the tissues in the throat stick.
Yeah, that's exactly what's happening.
Instantly stick. Okay?
Oh, boy.
And guess what happens when that sticks? You got a sleep apneic event. So all goes back to the nose. And this is why I sound like a crazy woman in my office when I'm saying, okay, so we're going to talk about the nose. And they're like, I'm not here for that.
No, but because they're all linked together.
Exactly.
They are here for that. Folks, you are listening to The Sleep Show alongside Dr. Bethaney Brenner. I'm Gary Byron. You can find her online at theburlingtondentist.com. We forget that. She's a dentist. Even though for the purpose of this show, we talk sleep. But if you want to find more information, head on over to our website, theburlingtondentist.com. More importantly, I would say jot down this phone number. I don't want you to miss much of the show. So you can call it at the end. You can call it tomorrow. You can call it Monday. Just call it this week. Call it. That's the bottom line. 860-673-7155. 860-673-7155. You got another opportunity more towards the end of the show in case you just missed it. Dry mouth.
Okay, so we just alluded to what can cause dry mouth, okay? So medications play into this role, all right? So I have to see what medications are you on? So guess what? We have a lot of medications that are out there for depression, anxiety, panic attacks. Guess what? They all cause dry mouth. Oh. Now, depending on the dosage and how many you take, because some don't just take one, they take 2 or 3, okay? And they get a very dry mouth. So I start to see decay with the dry mouth. I see periodontal disease with the dry mouth. And the studies, there's about 12, at least the last count I did was a couple of years ago. They had 12 studies that showed there's a link with periodontal disease or gum disease with sleep apnea. So if you have periodontal disease, we should be testing you to see how bad your sleep apnea is. So when they come to the dentist, and I have dentists now, interestingly, because I write articles for this, and the periodontists get this, at least a few do. And I get some nice emails from the guys that I know. And they're like, oh, this was a great article. The general dentists they say, just like the pediatricians do, we don't have time to look for that. Okay? Because they don't want to learn what a malampati is. They don't want to have to look at the scalloping tongue. They don't want to look at the coating on the tongue. They don't want to look at how people swallow. They don't want to check their nose by any means. And they don't look at their blood pressures either. So these are things that are routinely done in my office.
They need to be.
I think they do because I'm the backup to the physician, right? Because you only go maybe once a year. Guys sometimes don't go for a couple, 2-3 years because they're like, I'm fine, right? There are people that just don't go at all. They will go to the walk-in clinics when they need them. And so there's nobody really monitoring and checking on them. But we typically see people a couple times a year. Now, if you have periodontal disease, we're seeing you more often. If you have diabetes, we should definitely be seeing you more often. Okay? But I have people that's like, my insurance doesn't cover it and I can't do it. And I'm like, this is not a good idea. And it's not because of the sleep apnea. It's because of what the side effect to having sleep apnea does, which is more decay and more periodontal disease.
If you have a clear airway in your nose, okay, what's easier, breathing through your mouth, or breathing through your nose? What is your body, without consciously trying to do one more than the other? What does your body default to?
You will default to nasal breathing.
Nasal breathing. Okay.
Yeah, because you'll be able to keep your lips together. Now, if your teeth are very badly crooked, and this is another clue. If you have what we used to call buck teeth when we were a kid, your upper teeth stick out.
People still have buck teeth, though.
Yeah.
Yeah.
And they also have retruded jaws, so the jaw looks like it's back, right? Like you have like almost no chin, right? You see those
Those are usually people with no teeth, right?
No.
Oh.
No, they have teeth.
Okay.
But their airway is compromised already because the jaw is retruded, meaning it's back closer to your ears than it is out in your face.
Okay.
Okay, so you want to think about, we're already laying down, the jaw slacks and falls back. They're in that position all day long. So when I see that, and I had a whole family of 4 kids that I treated orthodontically, the mom's face was fine. When I saw dad, I was like, oh, there we go. They're all inheriting this face, okay? So I made sure that I brought all those jaws forward, non-surgically now, mind you, because this is why when we use the mandibular advancement devices for sleep apnea, we can actually get that Jay Leno. So
Jaw,
when I
right.
when I talk about that, so the guys who has a retruded jaw, we're bringing them into a more normal bite. So think about that. So if the people that are in a normal bite, we bring them forward, they get the Jay Leno jaw, and they can't go back again. So when I'm bringing them and holding them forward, we want that. So I have to be selective about who I do what with. People come in, it's like, don't you just make the same appliance for everybody? And the answer is no. There's 300-400 different appliances out there.
Sure.
What do you need based on your particular unique issues, okay? And everybody has to have some. Now, I have favorites, of course, but I also need people I need future adjustability in some people, especially if I think they're on that border of, are they going to lose the weight? Are we going to be able to control the sleep apnea? What's their breathing like? Are they compliant with doing things that I ask them to do? Because I get the ones that, okay, you fixed me, and then they go off and they think they don't have to do it anymore. And the answer is, okay, they go back downhill. So I see them again, and it's like, okay, we retest because we want to make sure that they're staying in that. And it's like, no.
All right, so we got about 5 more minutes here.
Oh, we're going fast again.
Yeah,
It always goes fast.
always.
Okay, so I want to talk a little bit about, I don't know what your next question would be.
Go ahead.
Okay, so lip taping, because this is another
Lip taping.
This is another way of keeping the lips together.
That one I never heard of. So
Okay.
fill me in, please.
So lip taping is a way to keep the lips closed to make sure you're breathing through the nose. Because as I said earlier, if you don't use it, you lose it. It's the same for adults, okay? So we need to teach people to breathe through the nose, okay? And so there's breathing exercises. Breathing exercises help you get into parasympathetic. Yoga helps you get into parasympathetic. Meditation helps you get into parasympathetic. Why are we talking about parasympathetic? Because that's a more natural condition to help promote better sleep. We want to have deeper sleep. We want to have good sleep. We want more REM sleep. And that's what lip taping helps with.
Oh.
Okay, so you can get better sleep if we lip tape. Now, if you have a problem breathing through your nose, you're not going to slap a lip tape on and go to bed, because you're going to wake up and you're going to rip that thing off and go, I can't breathe. Okay, so we have to start with getting you to understand what swells up the nose, getting you to change those behaviors, getting you to spray the nose to take care of any allergies or dryness, because this time of year, the humidity gets lower. And if we're breathing through our mouths get drier.
Why is this one something I've never heard of? Things you've been saying so far register with me. Like, yeah, okay, that makes sense. They're linked.
Yeah.
I've never heard of lip taping till right now.
Actually, the Olympic athletes who do track and field all lip tape practicing their sport. Why do they do that?
So
Think about it.
they breathe through their nose.
And it promotes better breathing. So think about this.
No, it makes sense. I'm just saying I've never heard of it.
And so when they lip tape during exercise, and I have people that will do that because I suggest that to them, they don't get any more panic attacks when they're climbing the cliff. They can run farther with less lactic acid in their legs, okay? They can breathe better, and they don't notice that they're struggling as much. It's a very interesting dynamic how the brain is calculating your oxygen intake while you're exercising, but you can't start with lip taping unless we get the nose to work better. This is why I talk about it. So that actually is why it improves sleep. But it can improve athletic performance as well. So we have all the track and field guys. So one of the guys, I think he ran in the Olympics a couple of years ago. Am I got that right? I don't remember which year now. But he was training with a guy from another country, and they went neck and neck down to the line, and I think the American won on that particular race. And because I like to watch them do this, it's a fun thing because you just see the athletic performance go up another level, and so that's why the Olympic teams are doing that.
Funny in an ironic way. Like I said,
The nose is very important.
I guess it is.
Yeah. So that's why I emphasize it so much. And then people are like, I'm here to do something about my sleep apnea. I'm like, yep, it's all connected.
Do you see a lot of athletes?
I see some. I see people who are, I want to say the weekend warriors a little bit. I see people who do mountain climbing, rock climbing. It's very interesting. I had one patient, and he used to like to climb in the wintertime. And he said, I made like Climbers Magazine or whatever it's called because he fell off this ice wall.
I don't even like walking out in the cold weather. He's climbing mountains.
Telling me that he took his electric toothbrush with him and it died in the 30 below zero that he was in. I was like, he goes, they don't work at 30 below. And I'm like, no kidding. That's
the least of your problems.
Exactly.
Buddy.
But he had it in his backpack because they camp on the side of these mountains.
How do you stay warm?
I don't know. I'm like, I would never be doing it. But then, I have trouble at this time of year.
Yeah. I don't even like going out and starting up my car to.
Yeah, exactly. So you got to be a special kind of person to do all that.
All right. Gotcha. All right. We got about a minute left. You want to give us a teaser maybe to next week or what we have to look forward to in the coming weeks?
I think I want to go back and talk about why some people struggle with a CPAP machine. Because we have people that they're not compliant. They can't stand them. I have people that come in and say, I hate it. I'm using it, but I hate it. And there's a reason why they hate it. So I think we ought to talk about that.
But there's been advancements in those machines, right?
Oh, they're quieter, for sure. They don't sound like a jet engine in the room
Are they
anymore.
as bulky?
I think the part that bothers me is that nobody's really monitoring it, even though the machines will tell you they're monitoring you. So that's a whole conversation.
If you would like more information on this topic or any of the others that we discuss on this show, head on over to Dr. Brenner, the BurlingtonDentist.com, theburlingtondentist.com. If you've got a question for Dr. Brenner, that's the email address I want to send you to. Dr. Brenner Radio, Brenner, and doctor is initiated. Okay, doctor. Don't spell it out. drbrennerradio@gmail.com. More importantly, I think calling her is the most effective. 860-673-7155. Again, 860-673-7155. For Dr. Brenner, I'm Gary Byron. Thank you so much for listening to The Sleep Show. And until next Saturday morning, have a good one, everybody. So long.